6 months after the state expanded Medicaid, lawmakers in Jefferson City may reverse the voters' decisions. Our Missouri Chief Capitol Bureau reporter Emily Manley explains why some are concerned this could affect Missouri's entire program. Emily.
Well, Vic, Missouri could have yet another question on the ballot about Medicaid expansion. This time it would ask if lawmakers should have power over funding the program and if work requirements should be there in place for those that are on the program.
That is definitely a line in the sand for us.
August 2020, the last time the question was on the ballot.
Yet here we are again, trying to undo the will of the people.
Missouri voters decided to expand Medicaid to an additional 275,000 people between the ages of 19 and 64.
This would allow us to uncouple parts of the Medicaid program and prioritize them through the appropriations process in the event that we should need to.
Representative Cody Smith is sponsoring the legislation, which would unravel what voters approved in 2020, giving lawmakers the ability to either fund or defund the expansion population.
I do think the idea of being able to find distinctions in certain populations to adjust to variables changing is not a bad idea.
But voters would once again have to approve it on the ballot.
The people voted on it. The court said they have to expand it, they have to fund it.
Besides funding power, it would also ask if those on Medicaid should be required to work or job search for 80 hours a month in order to receive the health coverage.
And this would just set a minimum threshold and say you need to engage in work. But if not work, community engagements.
This would require a State Department to track those hours, where Representative Sarah Unsicker says Missourians are already spending hours on the phone trying to reach someone.
Department of Social Services and our computer systems, our outdated computer systems, would be relied on to implement this. And they're not capable of doing this.
Now, under the legislation, there are some exemptions in the Medicaid expansion program for those work requirements. It would be, for an example, if someone had a disability. After passing the House yesterday, that legislation now goes to the Senate, where if it's approved, this question could be on the ballot this fall. Reporting live tonight from Missouri State Capitol Bureau in Jefferson City, I'm Emily Manley, Fox 2 News.